Most common site of fracture of proximal humerus. Surgical neck of humerus pass through greater and lesser tuberosities. Risk factors for fracture of proximal humerus. Postmenopausal osteoporosis woman, rate of osteoporosis in proximal humerus greater than any other part. Classification for fracture of proximal humerus is called Neer's classification, type 1, 2, 3, 4 based on No of fragments. Type 1 equals 0 fragments, undisplaced bone. Parts, head, greater, lesser tuberosity, shaft. Most common injured nerve in fracture of proximal humerus and shaft. Proximal humerus axillary N, shaft, radial nerve. Fracture of shaft of humerus. Fracture between surgical neck and supracondylar area. What's Holstein-Lewis fracture? It's fracture of shaft of humerus at junction of upper 2/3 road and lower 1/3 road. Here radial nerve perforates lateral intermuscular septum. So this fracture causes radial nerve entrapment, so wrist drop and sensory loss. Treatment of Holstein-Lewis fracture. Cock-up splint. Management of fracture of shaft of humerus. Fracture with radial nerve injury, closed reduction plus pop. Examine recovery of nerve function for 3 months. If no recovery, nerve conduction study done. If still no recovery, surgical explore nerve and ORIF. What kind of joint is elbow joint? Ulnohumeral joint, hinge type. Types of fractures around elbow joint. 1. Supracondylar humerus. 2. Lateral condyle fracture. 3. Medial condyle. 4. Transcondylar. 5. Intercondylar. 6. Ocranon. What's 3-point bony relationship in elbow? It's maintained and disturbed in what all fracture? Lateral, medial condyle and Ocranon lie at straight line. It's maintained in supracondylar humerus fracture. Disturbed in rest all. Supracondylar humerus fracture is what type of Salters-Harris type fracture? Type 2, where fracture line enters growth plate and exists via metaphysis. What's the most common fracture around elbow in children and why and mechanism of injury? Supracondylar humerus. Because anatomy. Mechanism of injury hyperextension. Types of supracondylar humerus fracture based on displacement of distal fragment. 1. Extension type post. Displacement cause of triceps pull. 2. Flexion type ant. Displacement further subtypes. Name of classification for supracondylar humerus fracture. Gartland classification. Type 1 undisplaced. Type 2 anterior cortex breached but posterior cortex intact. Type 3 displaced complete fracture. Clinical sign seen in Gartland classification. Type Fat pad sail sign. Hematoma around fracture pushes away fat, so sail-shaped lucency around supracondylar area is seen on X-ray. Clinical sign seen in Gartland classification. Type 3 fracture. Fish tail deformity. Distal humerus appears fish-like in X-ray. Temporary management of supracondylar humerus fracture. 1. Dunlop traction. 2. Bowman angle, to determine adequate fracture reduction. 3. ORIF. Early complications of supracondylar humerus fracture. 1. Brachial artery injury. 2. Compartment syndrome. 3. Volkmann ischemic contracture. 4. Nerve injury, ant interosseous greater than median greater than radial. Late complications of supracondylar humerus fracture. Meloonian cubitus varus, myositis ossificans. Pathogenesis of compartment syndrome in supracondylar humerus fracture. Brachial artery injury, blood supply compromised, muscle ischemia, hypoxia, inflammation, swelling of muscle, further compresses vessel of same compartment, muscle necrosis, contracture Volkmann and first muscle affected in compartment syndrome in supracondylar humerus fracture. Flexor digitorum profundus. Clinical features of compartment syndrome. Pain on passive stretch, swelling, pallor, paresthesia, paralysis, pulselessness. Investigation for compartment syndrome. 1. Compartment pressure using manometer less than 10. 2. Differential compartment pressure greater than 30. Treatment of compartment syndrome. Fasciotomy. Longitudinal incision on superficial and deep fascia in LL compartment. Deformity in Volkmann ischemic contracture. Elbow flexion, forearm pronation, wrist flexion, finger clawing, plus sensory loss and motor paralysis in forearm and hand. Treatment in Volkmann ischemic contracture. Mild, turnbuckle splint. Moderate, Max Page. Severe bone shortening. Overall most common cause of compartment syndrome and in children. Overall tibial fracture. In children, supracondylar fracture. Pink pulseless hand. What is it? In supracondylar humerus fracture, due to brachial artery compression, radial pulse weak or absent, but due to collateral circulation, limb appears pink. Normal carrying angle in arm for females and males. Female 5, male 10 to 15. Myositis ossificans pathophysiology. Massage of fracture done. Fracture hematoma dislodge, settles inside muscle, bone forms inside muscle, so restriction of movement. Most common muscle and joint involved in myositis ossificans. Muscle, brachialis. Joint, elbow greater than hip. Fat embolism syndrome features in fracture. Polytrauma, long bone fracture. After 48 hours, difficulty breathing, tachypnea, petechial rash. Lateral condylar humerus fracture mechanism of injury. Fall on outstretched hand with slight varus force. Difference between lateral condylar humerus fracture and supracondylar. Supracondylar is extraarticular, it is intraarticular. Supracondylar is type 2 Salter-Harris, it's type 4. 3 bony relation is maintained in supracondylar, not here. Fractures of necessity. Those which require surgical intervention. 1. Intraarticular. 2. Monteggia. 3. Lateral condylar. 4. Neck femur. Complications of lateral condylar humerus fracture. 1. Elbow stiffness. 2. Non-union due to pull of common extensors. 3. Damage to lateral growth plate. Damage to lateral growth plate in lateral condylar humerus fracture. It causes growth of medial greater than lateral condyle. So, cubitus valgus deformity. Also stretching of medial elbow structures causes tardy ulnar nerve palsy. Management of olecranon fracture. Or if with tension band wiring. Most common joint dislocation and in children. M.C. shoulder. In children elbow dislocation. Clinical features of elbow dislocation. Reversed 3-point bony relation. Flexion at elbow, attitude. Bow-string sign, laxity of triceps. Terrible Hotchkiss triad of elbow. Posterior elbow dislocation, coronoid fracture, radial head fracture. Cold elbow, nursemaid's elbow. Radial head pulled out of annular ligament. Mechanism of pulled elbow. In children less than 4 to 5 year age, unossified smaller radial head and large annular ligament. On axial traction of extended, pronated elbow. Radial head subluxates out, it's self-limiting.